Okay, well, we'll go ahead and get started. Welcome again to our parent webinar. I am so excited this evening to have Dr. Evie Sabet with us from Carolina Bright Smiles. This is such an important topic, so I am so glad that she's here to educate parents in her community about what she's doing in her office. So I'm going to tell you a little bit about Dr. Evie. Patients love Dr. Evie because she sees you as a person, not a number. She's able to look at your overall health and help you make decisions in her office that will impact your entire life. She understands that it's not just about fillings or a crown. It's really about providing genuine care by focusing on the whole person. And for a child, this starts with their airway. So education is key for both parents and doctors. And so Dr. Sabet has actually extended her knowledge of assessing and treating pediatric airway and sleep and breathing issues with the Healthy Start system as a certified provider. Dr. Evie Sabet graduated from the University of Maryland, Baltimore College of Dental Surgery in 2009. She's licensed in Florida and North Carolina and has worked in 9 different roles as a dentist, varying from starting a practice on her own to being an assistant clinical professor at East Carolina University School of Dental Medicine, to providing dental care to patients in nursing homes using mobile dental equipment. Dr. Evie has been honored as a university scholar at the University of Florida, a member of Gorgas Dental Honor Society, and the winner of the Baltimore College of Dental Surgery Managers Award. In addition to her accolades, Dr. Evie stays connected and up to date with memberships in the American Dental Association, North Carolina Dental Association, and the American Academy of Dental Sleep Medicine. The best part of Dr. Evie's job is meeting new people, getting to know the community she serves, and in most cases, a dentist sees patients more often than their primary care doctor. So she values getting to know her patients and their families and being a part of their lives. And this is actually part of that. So I'm actually going to take this time, and I'm honored to do this, to hand the screen and the mic over to Dr. Evie.
All right, can you hear me?
Yes, sounds great.
Yep. All right, you ready for me to share my screen?
I am ready.
All right, here we go. All right, so we have lots of fun things here today. Let's see if I can get my screen right. Technology is always so fun. So I apologize, we don't have the video working today, but there's lots of great information on the slides for you to look at. So here we go. So she kind of gave me quite an introduction there. I came to start studying sleep in kids a couple of years ago when I started looking at adult airways and looking at adult sleep medicine and making appliances for older folks. And in doing so, started to think, well, how did they get here? Why is it that I'm seeing so many adult patients with these airway issues? And all we can really do at that point is give them a dental appliance or put them on a CPAP. But why are we here? And that's when I came across Healthy Start and saw their appliances and really made the connection with airway development so we can avoid these issues. What we're seeing with kids right now is pretty amazing. We've got a lot of kids experiencing symptoms, and you'll hear it at your children's schools or on Facebook or in the media. We have this epidemic, this crisis of kids that have behavioral issues. And what could these things be coming from? And there's a connection with sleep and all these things listed on the screen here. If they're not sleeping, they may be diagnosed as ADHD. They may be difficult in school, having issues there. They're not sleeping through the night. Some of them have stunted growth. Some kids suffer from night terrors, nightmares. Lots of allergy issues right now you hear about often. Kids allergic to a lot of things, asthma, lots of mucus and that sort of thing. Dark circles under the eye, swollen glands, swollen tonsils. Sometimes these kids even have aggressive behavior. They're just exhausted. And there's even a connection with bedwetting, which we'll talk about later. So it's really affecting a lot of our kids. And dentists, we can see these issues simply by looking into the child's mouth and asking a few questions to their parents. The research is pretty strong. There is a link between sleep disordered breathing and these conditions. And what I really love about this kind of treatment is we're going to get to the root causes of these things and help grow these kids out of there. Traditionally, what's been happening right now with kids who have sleep disordered breathing, it may not be, since physicians and dentists really right now, we're not connected the way we should be. And these kids may be misdiagnosed with other issues, right? Psychiatric issues, having to be on ADHD medications, prescription medications, then you have to give them another medication to deal with the side effects of those medications. And these are growing bodies. We really, giving these growing bodies all these medications is quite serious. And then we also have, maybe they're giving them sleep aids, changing the diets. Maybe they have to now go to speech therapy, tutoring, special education, and really it just comes down to we need to develop the airway, a simple solution without having to go through all these medications and therapies and things. These may be adjuncts, but let's get to the bottom of it. So, kind of what I covered in the last slide was just that some of these things are Band-Aids, right? We're not treating the airway. We're not getting to get them to sleep through the night. We're not providing oxygen to the body to make this child grow and develop the way they should be. And so you might be thinking, okay, what is a dentist even talking about airway? What is, how is this all connected? Well, the mouth is the first step in the airway. The mouth and the nose. This is where the airway begins. And dentists get to look into that airway every 6 months. And when we do that, we are able to look at this child and connect the dots. How is this child's development changing over time? And how is their sleep? How is their behavior? So, moms and dads might bring their kids into the office and we look at the child's teeth and tell them, oh, there's no cavities or there are a few and whatnot. And then I start talking about the shape of their mouth and their airway. And parents are kind of like, okay, I came in for cavities and now you're talking about snoring? How is this all connected? Well, it's not just about straight teeth or being cavity free. It's about the overall well-being of your child. And the mouth tells a story. And this is the story it tells. If you look at these faces here, you kind of ask yourself, does this child look healthy? And we see these kids come into the dental office. You can kind of see those bags underneath the eyes here. We call that venous pooling. It's a sign of a very tired child. Some mouth breathing. We'll see chapped lips and some skeletal issues that I'll be showing you in the next slide. Here we go. So ask yourself if you see a child like this. Is this a healthy child? You see this kind of mandible that's tucked in, the small underdeveloped lower face. And on both of these young girls, the way that lower mandible is tucked in impacts that airway. They've got much smaller airways than they should. So why are we now talking about this? Well, over the years, things have kind of gotten connected. We're seeing the connection between sleep and what we're seeing in the mouth and airway. My favorite thing to say these days is it's all connected. It's not compartmentalized anymore. It's not just the dentist treating teeth and the doctor treating the body. It's all connected. So when we're looking at these kids, we have a greater awareness of the severe effects on this child's health from these things. When a child is mouth breathing, it allows that mandible and tongue to be displaced posteriorly. And that's what I was showing you on the airway before. I'm going to click back. You can look now about how that mouth breathing impacted the way these two young girls' face appear. See here? That tucked in mandible, that lower face is not developed. Some of these kids will present with habits like finger sucking, abnormal tongue thrust, abnormal swallowing. This all has impacts on the upper arch. It can be constricted. They may have a high palate. It'll decrease their nasal breathing, increase mouth breathing. These things will reduce the REM sleep, and it'll affect the brain function, the endocrine system, the immune system. All of these things come together to create issues like behavioral problems, sometimes social and overall health symptoms that are coming from this lack of oxygen and sleep deprivation. Here is a great picture of growth pattern, normal growth pattern from 2 to 17. And you can see that downward and forward. That is what we want to see in these kids, downward and forward. In the picture that I showed you previously, you saw those young ladies, how it was tucked in. It was almost backwards. Their jaw was almost going backwards into that skeletal development. We want it forward and downward. At age 2, we've already hit 55% of the development. So if there's issues going on, if the child is sucking pacifiers or their fingers or improper bottle habits, we've already developed the child 55%, and it may have been in the wrong direction. Then by 4, we've got 73.3 to 77.68. So by 4, if they're still sucking pacifiers and fingers, or they still have tongue thrust issues, which most children will if they have them to begin with, because we really can't stop these things without intervention. Well, now we've done 73.3% of that. So when you bring your kids into see me, a lot of times I'll tell parents, we need to start now. We need to intervene now. Traditionally, a lot of people will think of braces, oh, that's teen years. Well, look at that. At 12 years old, we have almost 90 to 95% of the growth is over. We've missed all of this growth and development. So now we can really only fix about 5 to 10% of this. Then the rest, they're on their own. They might end up with a CPAP later, oral appliance therapy later, but those are all just helping with symptoms. We can no longer grow the child out of these things. So what I really want to impress upon folks listening is that in this age group, I really like starting around between ages 4 and 6. And of course we continue on at 8, 9, 10. But really at that 4 and 6, we have a sweet spot where we can get growth, and we still have 25% of that growth taking place. We can intervene and make a huge difference. So here's a statement about that forward and downward. That's what we want to see. When we want that growth to be forward and downward. But why are we having so many kids not develop forward and downward? If that's the way we're supposed to grow, why are we not growing that way? It's a really great question to ask yourself. So there's been some really great studies. If you want to delve into this a little bit more, I can get you more information on it. But there's been some really great studies about our consistency of diet, even a decrease in breastfeeding, those sorts of things have really changed the way we look. Our dietary consistency has changed. It used to be that children would go from nursing to then eating what mom and dad had on the table. Well, now we've got highly processed foods that are extremely soft, Kids are, even eating their food out of literally bags. You've probably seen those bags that you can get at the grocery store that have the baby food in them. So they're sucking the food in. So we're really producing children that don't have the muscles of mastication. They're not using their tongue properly, and we're producing kids with malocclusion. So in this study of Western culture, you can see over time, the study looked at generations with the soft food diet. In the first generation, 50% of these kids had malocclusion. Second generation, 70%. Third generation, 85%. So basically, we're producing kids that have malocclusion. And malocclusion then goes back to the airway and decreases airway size. So we have this growing amount of children with smaller airways. And we can see it even in our adult population that we treat with CPAPs and oral appliance therapy, that we're now treating. These are adults who've had these poor upper airways untreated. So we have this chance to intervene now and treat these kids before producing what is the next third, fourth, fifth generation. What are we going to get to? 99.5%. We don't want to see that. So let's intervene. So what we'll talk about here is some of the things I see a lot of that come into the office. Prolonged pacifier use, prolonged bottle feeding, and then of course the overly soft food diet. I mean, it's really difficult, and I've got 3 kids myself. The last thing you want to deal with is your child chewing hard foods. You're afraid they're going to choke, and so you want to give them softer foods. So it's kind of this area that you're like, what do I do? How do we develop these airways in a way that we're not worried about that? So it is a difficult place to be in. Now with the pacifier use and the bottle use, that's definitely something we can deal with. We really don't want anything to interfere with the tongue position. What happens with pacifier use is that tongue is not allowed to touch the top of the mouth, because that's where the pacifier is. The tongue is really the first orthodontist. The tongue shapes the mouth. The shape of the mouth determines where the teeth go. So if the tongue is left to do what it's supposed to do, we can decrease malocclusion. But instead, we'll have a pacifier in between the tongue and the roof of the mouth. Now we have a tongue that's pinned to the floor of the mouth, unable to shape the mouth properly. And the same comes from prolonged bottle feeding. The child's tongue learns to move in a specific manner because of that bottle. And sometimes those bottles, the milk is coming so fast, the child even develops what's called a reverse swallow, trying to kick the milk out so they don't choke. So that then we have some tongue thrust issues. So here is some pictures of prolonged pacifier use, bottle use in sucking fingers, this anterior open bite. The maxilla kind of has this arched anterior shape to it. You can see right where that pacifier or bottle or finger was. And so then this child will develop most likely anterior tongue thrust. They'll continue to develop in this manner unless there's some intervention. So let's now look at what a kid looks like that we want to see. These pictures are pretty decent. I actually would prefer more spacing than this. On the anterior, I'd like to see a little bit more. We want spacing in your child's teeth. Some parents will come in and they'll say, oh, my kid's teeth are perfectly straight, and they're side by side by side. And unfortunately, teeth being side by side and close together at a young age is not a good thing. That means we have underdeveloped maxilla and underdeveloped mandible. So we need to develop them. This is a picture of an airway, so you can kind of get familiar with it. So the teeth and the tongue impact this airway going back here. The nasopharynx, the oropharynx. And so from here, as the child breathes, the air comes down. This is almost like a big, huge funnel. If we are not developed in this anterior airway, in this interior area here, it's going to pin back this tongue. It's going to pin back this tissue. We're going to see it really small through here. So kind of study this picture for a second. Look what a nice big open airway looks like. I'm going to show you some airways in a minute. They're a little bit more pinched in. So kind of memorize this for a second here. Okay. Looking back at this picture here, talking about this airway, I promise we'll get to those other airways shortly. That air is going to be coming through here. And if a child has an open mouth and they're mouth breathing, and this area is getting pinched in here, there's some things happening with that mouth breathing. So if they're breathing through that mouth, they're not using their nose. And that nose is really important to use. It warms and moistens that air. The mucous membranes trap the dust and the pollen and the bacteria. And these sorts of things are going to aid in decreasing allergy type of symptoms because the nose actually filters out a lot of the stuff we breathe in. That's how, in the earlier slide I was talking about allergic type symptoms. If children are mouth breathing, they're kind of breathing in all this dirty air. It's not getting cleared by the nose the way it should. So there's a really great sleep physician who is studying these sorts of things from Stanford University, and he's been pairing up with dentists to talk about this because he believes in the connection between sleep disordered breathing and the development of the maxilla and the mandible. So from his study, he believes that dental arch expansion improves sleep disordered breathing in patients with upper and lower jaw constriction, and that it can be a valid treatment. So this is coming from a sleep physician, not from a dentist. So this really shows the crossover between the two. Here's the airway I promised you. So if you have that other airway, the perfect airway in your mind that I showed you, the purple and green. So now look at these two airways. Here's a normal airway. Kind of looks like that model I showed you of the drawing. Nice, open, big tube. Now, this guy here, if you drew a line, right, it's almost flat. Look at this one here. Look how forward it is, forward and downward. And this one's flat almost. Now compare the airway. Look how pinched in it is. Look at that. Now we look at the one that's forward and downward. Look how open it is. Here is the connection right here in X-ray format of the connection between the airway and dental development. It's pretty neat. We have a big responsibility as dentists to help identify this. This right here, identifying this can be the difference between a child who is left being untreated on medications, becoming an adult who snores and probably is then on a CPAP, who is then at high risk for stroke and heart attack as an adult. All we have to do is develop them forward and downward. They become a different person with a different future. So here's the same pictures, but with the skin on top. This is what you'd see walking into your office, or you may see as your child. Here's that forward and downward. And you can kind of look at the nose and chin. you kind of have a nice curvature here, little slight C curve. Then here, it's almost as if the jaw is developing backwards, not forward and downward at all. It's almost backwards, it's tucked in. So here's a cute little picture. A lot of people post these kind of pictures on Facebook. Kid passed out in the car, sleeping through their mouth, breathing through their mouth, maybe doing a little bit of auditory, like the breath is so heavy, it's auditory, you can hear it, maybe a little gurgling. And oh, look at little Jenny, she's passed out, she's so exhausted from all the fun she had today. Well, in reality, she might be tired from her activities of the day. She's also really tired because she's breathing through her mouth. The poor little one is not getting enough oxygen. And the kind of amazing thing about this is without intervention, it does not improve in 82%. So 82% of these kids from 2 to 12 years of age do not improve. So we got to do something about that.
Listen to this mother describe her baby's sleep disorder breathing.
Yes, 2 seconds. There he goes.
Now watch what happens when she's able to open the airway by simply shifting the position of his jaw.
Now watch what happens when I take his jaw and I just bring it forward. If I can, let's see if I can. And I open his airway. Just bring his airway forward. Now listen to the quiet breathing. There we go. Now he's breathing through his nose.
So it's a pretty neat video there, showing you what downward and forward motion can do for an airway. And most of you can probably relate to that video of your child in the car seat, sleeping that way. I really like that video. It kind of shows everybody exactly what I'm talking about in an experience that they probably have had in their own backseat. So here's another picture. Remember that airway I showed you before, that nice, beautiful picture of the open airway. So here's a normal 5-year-old airway. Nice, big, open. And then here is a constricted airway. So very, very easy to identify. When a child is mouth breathing, you've got a couple different things happening. Usually you have that underdeveloped mandible, you'll see some chapped lips. And here we go. So their mouth is open here. This just shows you physically what's happening. So the air is coming in through here, but as the jaw goes downward and backward, it's going to constrict that airway. So your child may be breathing, but if they're a mouth breather, they're really not getting the oxygen they should be. Look at the difference here. That airway there, then here's a nasal breather. Nice open airway. So we have to ask ourselves, when we look at our patients and we look at our children, what does their airway look like? Is it as tiny as a little stirring straw? Or is it nice and wide open, like that hose over there, giving the little girl a drink of water? What does their airway look like? And if it's constricted, we're going to see a lot of behavioral issues and developmental issues that really has nothing to do with their child. It's all because of that airway. So here's just kind of a little diagram of what's happening with our kids. Extended bottle feeding, pacifier use, poor tongue position, abnormal swallowing, soft diets, processed foods, habits like thumb sucking, lip sucking, tongue thrust. They all lead to underdeveloped dental arches and jaws. That underdevelopment then causes that compromised airway. We see mouth breathing, snoring, swollen tonsils, and adenoids, low tongue position, tongue thrust, poor developed dental arches, crowded teeth, crooked teeth, overjet, overbite issues, crossbite. These things then lead into this restless sleep, ADHD, bedwetting, chronic allergies, nightmares, drowsiness, aggressive behavior. So it is all connected. That's definitely become my theme. It's all connected. So why is the dentist talking about it? What in the world can a dentist do to deal with any of this? And this is what I'm bringing to you tonight. Healthy Start appliances. I have seen a world of difference with these appliances. All three of my kids wear them. I couldn't be happier to bring this to you. These appliances are made with tons of research behind them. They're all FDA cleared, no latex, no plasticizers, BPA free, phthalate free, no silicone. Pretty amazing stuff. And there's been now 4 million cases worldwide. This is a great group, well studied, well researched. So what these appliances do is they're going to expand the dental arches. So we're going to start developing this airway from the place we can get to it, the mouth. We're going to pop these appliances in. They're going to help us eliminate mouth breathing. We're going to increase nasal breathing, widen those arches. We're going to retrain the tongue, because that tongue, like I told you before, it is nature's orthodontist. If we can get that tongue to do what it's supposed to do, then we're going to shape this mouth. And that's what the very first appliance called the habit corrector does. It retrains the tongue. And then we're going to eliminate all these bad habits, the thumb sucking and all of these sorts of things that are causing some of these issues. The other thing it does is it's going to advance the mandible, producing that downward forward growth. So we're retraining the tongue, producing downward and forward growth. And kind of the amazing thing is even though we're doing a lot of this for airway, we're going to actually straighten teeth. Pretty neat. So as we do that, we're going to guide these teeth in straight, and it can reduce and eliminate future orthodontic relapse and reduce the chances for needing orthodontic treatment later. So there's lots of research and things going into this about the connection between these two things for children. We can provide some of these articles to you if you'd like. Just let us know. The founder of Healthy Start's been Dr. Bergensen. He's an orthodontist. He designed these appliances, and he's been featured in lots of dental journals about this and all things he's done for sleep disordered breathing. So when you come into the office, we're going to be asking you lots of questions. You're going to need a questionnaire that looks a little bit like this, so that we can really pinpoint what's going on with your child to see if they're in need of appliance therapy. So here's a few more little things here about the results. With the appliances, we're going to see a decrease in snoring. And one of the other things that we haven't talked about yet, but I'm going to touch on, is bedwetting. So let's see here. This last little statement here on this slide I really like here. People ask, will a child just grow out of this on their own without intervention? The answer is no. So between 4 and 12 years of age, 92.6% of symptoms did not self-correct, while 30% worsened with age. So for parents who are thinking the kid's going to grow out of this, the answer is no. They're not going to grow out of this. So here's some information about sleep deprivation and mouth breathing. So as these kids do this, they're not getting the right amount of oxygen, and they're really walking around deprived of sleep. This one here is really interesting. There's some case studies here that we're going to get into. This is a young man named Michael. And here's that underdeveloped, almost backwards mandible here. And then here he is at age 14. He was lucky enough to have Healthy Start intervention. Here's this downward and forward growth. Here's Michael's airway before and after. So we can see that little pinched off airway here. And that downward and forward growth. And here's Michael's airway after. Now, I wish this, let's see if I can move this. Oh, I can. I didn't know I could move that. Yay. Okay, so here is Michael dentally before and after. Look, so something I look at as a dentist, and if you're not, then you may not recognize this, but he's got a deep bite here. His lower incisor is touching probably his gingiva back there. Very, very deep bite. This is him after. No braces, no brackets, no wires, no braces. And look at that deep bite's gone. We can now see his lower incisors. His teeth are all straight in a row. So not only did Michael get a bigger airway and he can breathe better, he is now facially developed. He also has straight teeth. It's pretty remarkable. Okay. So there he is, cute Michael, all grown up. And here's some other kids. So here's this high arched palate leading to some upper airway issues. This is just 12 months of Healthy Start. And you can see the difference in that palate. Look how much whiter it is. Now the teeth are nice and straight and rounded off. Here we had some lower anterior crowding. You can see that tooth is out of place there. And then we have this nice round arch. Beautiful. So we're going to kind of circle back to a few things here. Talked about before the connection between sleep disordered breathing and ADHD. So there was a great study done about sleep disordered breathing and ADHD on 11,000 kids over 6 years. The study was published in a peer-reviewed journal of pediatrics in 2012. And the key result was that sleep disordered breathing increased the risk of ADD and ADHD by at least 50%. So a lot of these kids on ADD meds may not need to be on them. They may need to just have their airway treated. Wouldn't that be nice to not have to take medications for behavior? Just getting a good night's rest is all they really ever needed. All right, so some of the effects of the long-term issues of kids with sleep disordered breathing, when you see the SDB, that's what that stands for. And sleep deprivation, these kids are getting held back in school for having school issues. They're too tired to function, their brain's not getting enough oxygen, and they're having a hard time in school. So this is a slide that I thought I was going to get to earlier, but here it is. It's about bedwetting and how the airway may affect bedwetting. There's a couple different theories on why sleep disordered breathing and bedwetting are connected. This statement here is that it probably interferes with deep REM sleep, which affects the neurological and hormone systems that then interfere with the control of the bladder. Some of the other things that I have heard in courses I've taken is that two things. The first is that if a child begins to not breathe while they're sleeping, there's a reaction from the body. You know, all of the muscles will contract to try and wake the child up and get a deep breath, and you'll hear a big gasp from the child, and then they'll begin to breathe normally. During that big contraction, well, what is the other thing that contracts is that bladder. And there's almost like a fight or flight response. The heart will even race during that time period, and the child might have been experiencing a nightmare related to it. All of these things are connected, right? The lack of oxygen, a nightmare, then a big gasp of breath, and then they wet the bed. One of the other theories is that once they do get into that deep, deep sleep that they don't normally have, they're so sleep deprived that they finally, their bladder releases and they wet the bed. So there's multiple things that folks are trying to figure out why bedwetting and sleep disorder breathing are connected. But really the why may not be as important as we just know they're connected. So if your child is bedwetting, if we get them in an appliance, there's a good chance it's going to help. All right, let's get into some fun case studies here. Here is this little girl here. This is quite a common one that I see quite often. You can see over here she's got an underdeveloped mandible, and then she has almost a little bit of what we call class 2 starting to develop on the anterior here. She might have been a finger sucker or a thumb sucker. You can kind of see the space in here that she might have been creating. So she was, you can see here also kind of the underdeveloped mandible. If you kind of draw a line here, you can kind of see how things are kind of looking almost backwards a little bit here. The lower base is small. And then here we see that it's more forward. And then here is a beautiful, beautiful smile at 12 years old for her. So this is her progress from 5 to 7. You can see that facial development. And then the dental development from 5 to 12. No braces. If this 5-year-old, if I saw them at the dental office, I'd for sure know that orthodontics was in their future without intervention, because this maxilla is going to continue to outgrow that mandible without intervention. So she'll end up with those 2 front teeth being really forward and underdeveloped tucked in mandible. This is a great one. So again, we have that protrusive shape of the upper mandible, might have been finger sucker, thumb sucker. So you can see this is overdeveloped and forward. The posterior mandible is almost pinched in. It's underdeveloped. Excuse me, the posterior maxilla is underdeveloped, almost pinched in back here. So you have a forward portion maxilla, the posterior is pinched in, then an underdeveloped mandible. You can see it kind of in his face here, how the maxilla is kind of coming forward and the mandible is kind of pointed inward almost. So this is, and this is a late case of healthy start. So this is a very difficult case, going from 12 to 14. He was a little bit dentally behind. You can see there's still some baby teeth back here. So he was able to be treated. But typically once boys get into the early teens, game over, we're in braces and the airway is going to be what it's going to be. So this is a very special case. All right, here's another fun one. You can see how that, even in the picture, you can see here, it's all shadowy back here in the back because the dental arches are very narrow. And then from 8 to 9, you can see how it then is more rounded. And you can also, now you can see, hey, you can see all the way to those back teeth because it was developed in a more wide arch form. And here's his cute little face. You can see that development of the mandible too. Pretty neat. So the bottom line really for me as a practitioner, and I'll tell you this, I'd say May of 2019 will be 10 years of doing dentistry. And this is, I think, the most exciting thing that has come out in dentistry for me. I love treating children with these appliances and watching them grow and change. I've had several patients who've, had issues with speech who now I can hear them clearly. Patients with bedwetting who are no longer wetting the bed, children who are snoring who are now sleeping through the night. To be able to intervene and change these kids' lives is the most rewarding thing I've done in dentistry. I can do fillings for you, crowns for you all day long, and it'll be better for you, right? You'll have a nice filling, you'll have a nice tooth. But this changes kids' lives. It changes their trajectory, really. Going from someone who may be high risk for sleep disordered breathing as an adult, which then puts them at high risk for strokes and heart attacks, to then giving them great upper airways and decreasing those risks of sleep disordered breathing as an adult and heart attacks and strokes. And it can literally change lives. And that, people throw those terms around, I think, too much, that something can change their life. Some product on TV or something, oh, this changed my life. No, I do not throw those words around. These appliances can change someone's life. So it has been, Healthy Start has provided 4 million cases across the globe. There's not too many things around that can change the trajectory of a child's life that is pain-free, non-invasive, non-surgical, is not a drug, so there's no pharmaceuticals, it's completely safe and effective. It's FDA cleared. You have an open airway and straight teeth. Don't think there's really very many things that can beat that as far as treatment goes. Pretty neat. So I'd love to see you at my office. I'd love to take a look at your kiddos and or grandkids and see if this is something that could change their life. If there's anybody you know, or anybody, even kids that you'll now start identifying children and say, oh, that's a healthy kid, that's not a healthy kid. You can kind of take a look around you, and you may even see the sleep disordered breathing all around you. And if there's someone in your life that needs this, please give them our information. Join us at the office to begin your Healthy Start therapy and get that child grown out of these issues. That's what we're here for. I hope I gave you lots of great information tonight, got you motivated to come see us and think about airway differently now, and to remember that it's all connected, that what's going on in your mouth is related to the rest of your body. I thank you guys for logging in and listening to me. I look forward to seeing you.
Yeah, thank you so much, Dr. Sabet. That was absolutely wonderful. And, tonight was really all about raising awareness. So we truly encourage every parent to give them a call, schedule an evaluation. The fantastic thing is that Carolina Bright Smiles is doing this at no cost. I mean, you can call, you can schedule an assessment for your child. There's really nothing to lose and everything to gain. I mean, the fact is that 9 out of 10 children suffer from more than one of these symptoms. And the great thing is that there's a fix. There's an answer. So it's always such an aha moment, I think, for parents when they realize that, I get calls on a daily basis, but I had a call today from a young mom who her son had been diagnosed with ADHD rather, and she had been through so many different things and so many different issues at school and just having such a hard time. And she was going down the route of medication, and she really didn't want to go down that route. But that's where things were leading. And to know that she can have her son's airway evaluated and that there is possibly a different approach, a non-invasive and no medication approach for her to take. She was just thrilled. And so, again, there's nothing to lose and everything to gain. So I truly encourage you to give a call, schedule an assessment. And thank you, Dr. Evie. I thank you so much for tonight. This was absolutely fantastic. I really appreciate you taking the time to do this.
Absolutely, my pleasure.
Okay, everybody have an amazing night. Thank you for getting on, and please share. Good night, everyone.
Good night.